I'm glad to have here Dr. Anshu Banerjee, Director of the Division of Maternal, Newborn Child and Adolescent Health and Aging, World Health Organization. Wonderful. So you have a tremendous experience in your field, public health, and the impressive figure that 2050 we will have almost 2.1 billion people on this planet who are over 60. Is there any hope to cope with that?
Populations are aging, and as you mentioned, that we'll have 2.1 billion people by 2050, which is going to be double the amount of old people or people above 60, let's say, that we have at the moment. And so it's going to be very important to address that change, looking at changes in the economy, changes in healthcare delivery, but also changes in society and what that is going to mean. So on the healthcare side, I think what's going to be important is really to support to ensure that people will age healthily. And from that perspective, we as WHO have identified an approach that is not based on disease, but on how people actually function within society and based on what their intrinsic capacities are, let's say what their physical and mental capacities are, and how they as individuals engage within the environment they live in, and how that interaction can support their function within society. And from that perspective, it's really important to take a preventive kind of healthcare approach and make sure that we identify these declines in what we call intrinsic capacity early on in order to stop them, or to even better reverse them, and then, if not possible, to provide the interventions that can compensate for the loss in intrinsic capacity so that they can still function in society. So for us, what's very important is that we take a well-being approach to this, and we want that older people can function within society and do the things that they want to do and what they value most.
Yeah, you are measuring a lot and are getting a lot of data. How far are you to implement the data in real life now?
So we have data, but it's mainly from high-income countries. And so one of the things that we want to do is to make sure that we can also have surveys in low and middle-income countries so that we can have evidence-based policies also developed for low and middle-income countries. At the moment, there's really this divide, this gap of data availability only in high-income countries around all the people. And so that's one thing that's very important, because we're looking at healthy aging for all people across the whole world. And for that, we need the right kind of information in order to develop the policies.
And to extend health ban for the whole population globally, which programs will come soon?
So we have developed a global aging population survey module that we want to now start introducing in some of the lower and middle income countries. We have started, a couple of countries are piloting it, and after that we'll be hopefully ready with support, of course, with funding support to roll this out to other countries as well.
And it will need a mental shift. People have to develop a sensitivity for the aging process and also to be motivated to work longer, perhaps, in their life. Are you promoting that as well?
So those are discussions that countries, of course, will put in place themselves. We are working with other partners, such as the International Labour Organization, looking at the data and working together to see what would be the best way forward. And in the end, it are individual countries who have to decide how that will be done. But just to highlight that, we also get this request from many low-income countries to support them with their policies around aging. So even governments in low-income countries are already realizing that they are going to have an aging population and that they need to put the interventions in place to address that.
And to address young people, I guess this is very important. Do you have ideas, programs?
Yes. So when we look at healthy aging, we take an approach, a life course approach to that. So it is not only about providing interventions, let's say, when people are already older, but it's also looking at all the prevention strategies that we can put in place earlier in life. And so the adolescent period is a period where adolescents do a lot of experimentation around, smoking, alcohol intake, recreational drugs, risk-taking, etc. And so we have programs to develop together with them and to look at how they actually themselves want to have programs that support them in their healthcare needs. So we're doing this with a number of countries already, but it's very important that we take this life course approach and that we also look particularly at the adolescent period as a period where there's a lot of change in their brain development, and that we are able to guide that in the right direction, including what kind of food they eat, whether they have physical activity or not, because these are really factors that will play throughout the life course.
So perhaps you have a direct message for young people in our countries, Austria, Switzerland, Germany, what you like to provide?
So there are a number of, let's say, lifestyle choices that are very important for the rest of the life. And so the first one would be the nutritional intake and what kind of foods they take. So processed food, fast food is not good for your health. So, have more nutritious food, vegetables, etc., fruit. Secondly is to remain physical active. That's very important. That's important for your mental health. It's important for preventing dementia later in life. It's important for your bone health and not having osteoporosis later in life. It's important to not smoke. It's a risk factor for many diseases, whether it's hypertension, cardiovascular disease, or for dementia onset. It's important to limit alcohol intake. It's important to have good sleep. And it's important to have a purpose in life and to engage and to have your social connections. Those are all important things for your mental health and your well-being.
The consumption of social media?
The consumption of social media, screen time, there is indication that, like everything, it has its positives and its negatives. And it's really for you to limit, let's say, screen time and engage with people and have social engagement with people. That's good for your mental health. There's nothing wrong with, having your iPhone or your mobile phone, and but it's around limitation and so that it doesn't affect your mental health.
And we have here best level of social contact, and we are happy. Thank you very much.
Thank you. It's my pleasure.